they do in Texas plays. Fold them, let them hit me, raise it, baby, stay with me, I love it.
Look, this is Jamal, the guy you were talking about. He's coming here. Yo, Samantha, sick party, right?
Yeah, it's a lot of fun, Jamal.
Yo, follow me.
Pretty big stuff. I'm like street dog. My gear, up in here, up in there. Half American, half English, half this.
Hey, Samantha, you want me to show you something?
Yeah, why not?
Come with me. I hope you don't mind that I had him bring with me condoms.
Nah, no biggie.
Russian roulette is not the same without a gun. And baby, when it's love, if it's not rough, it isn't fun. Fun. Oh, I'll get him high, show him what I've got. I'll get him high, show him what I got. Carry man, no he can't read my poker face. She's got me like nobody. Carry man, no he can't read my poker face. She's got me like nobody.
Samantha, we need to talk.
About what, Mom?
I've noticed some changes in you recently. You've been nauseous, tired, and you missed your period. Are you pregnant, Samantha?
No, Mom, I'm not. I've just been stressed with the school.
How dare you lie to me? Your belly is bigger than your father's and breasts are developed as well.
I'm not pregnant, okay? I would know if I was. Stop making a big deal out of nothing.
How dare you? We're coming to the obstetrician. Hello, doctor. My name is Brittany. This is my daughter, Samantha. She's been absent at home lately, and now she's showing all the signs of pregnancy.
No, I'm not.
Okay, we can't really conclude anything without a proper blood test. Samantha, could you please sit down on this chair? Alright, we'll have your results ready in a week. Alright, you're pregnant.
Well, it's not my fault. Jamal didn't have a condom.
You shouldn't have been so irresponsible, but don't worry. It's okay. Okay, we will think about what we can do. Goodbye, ma'am. Have a great day. Yeah, I've noticed that there are a lot of students from her school who have turned up here with STIs and unwanted pregnancies. How about we ask our hospital to spread the information about sexual intercourses?
Yeah, that's a great idea. I'll tell our head physician of the hospital. Hello, class. Today we will discuss sexual intercourses during teenage years. We've noticed that there are a lot of cases of adolescent pregnancies in this school, so please, pay attention. Adolescent sexuality has always been something common. Even in very well-developed countries such as the United States, up to 30% of high school-aged teens had sexual intercourse in 2021. However, luckily, the prevalence of sexual activity among high schoolers has actually decreased. The statistics for 2019 showed that the proportion of teens engaging in sexual activity was 38%, indicating a significant reduction. Staba, 2023. Right now, teenage sexuality is becoming less common, due to the fact that it's now being viewed less as an inevitable fact and more as a preventable pandemic. So why should we be interested in preventing teenage sex?
The consequences of teenage sex can be harsh for society and for the individuals that had intercourse.
Of course, the two main risks with adolescent sexual activity are the risks of pregnancy and the risks of contracting a sexually transmitted infection.
Teenage pregnancy is an incredibly difficult situation that results in an individual's life completely changing, and having an abortion may not be an option for some mothers due to the legal code, their parents, or lack of access to medical treatment due to living in an undeveloped country. Teenage mothers usually do not have the financial stability to raise a child, and they are commonly shunned by society. This also impacts academic performance, since only 50% of teen mothers finish high school, and teen fathers finish high school 30% less than teenage boys. STIs are also a massive risk that young people face due to multiple factors. Hardin et al., 2009. In the U.S., people aged 15-24 account for 50% of people infected with STIs. Teen girls are especially susceptible due to the fact that during adolescence and young adulthood, women's columnar epithelial cells, which are especially sensitive to invasion by sexually transmitted organisms, such as chlamydia and gonococcus, extend out over the vaginal surface of the cervix, where they are unprotected by cervical mucus, but recede to a more protected location as women age. Advocates for Youth, 2014. Adolescent STIs cost $16 billion to treat in the U.S., while teenage pregnancies cost the U.S. taxpayer $11 billion to treat, making adolescent sex a powerful economic problem, which is even more severe in developing countries that have higher STI and pregnancy rates, but lower amounts of budget to deal with it. CDC, 2021.
If you've been out lately and faced the following symptoms, you may face an adolescent pregnancy. These symptoms include missed periods. The most obvious sign of pregnancy is a missed menstrual period. However, some pregnant teenagers may still experience light bleeding, which can be mistaken for a light period. Morning sickness, nausea and vomiting, often referred to as morning sickness, can occur at any time of day and usually starts around the 6th week of pregnancy. However, it can start earlier in some cases. Breast changes. The breasts may become tender, swollen, or feel heavier or fuller than usual. The area around the nipples, areola, may also darken. And other symptoms such as increased urination, fatigue, food aversions or cravings, mood swings, weight gain and bloating and constipation, CDC 2019, sexually transmitted infections, unusual discharge from the penis or vagina. This can be a sign of several STIs, including chlamydia and gonorrhea. Burning or pain during urination. This can also be a symptom of chlamydia and gonorrhea, as well as urinary tract infections. Itching, irritation, or inflammation in the genital area. These can be symptoms of various STIs, including herpes and pubic lice, sores, blisters, or ulcers on or around the genitals or mouth. These can be a sign of herpes or syphilis. Pain during sexual intercourse. This can be a symptom of various STIs, including herpes, chlamydia, and gonorrhea. Abnormal bleeding or spotting between periods. This can be a symptom of chlamydia or gonorrhea. Rash or small red bumps. This can be a symptom of syphilis or HIV. Swelling or tenderness in the groin area. This could be swollen lymph nodes, a symptom of several STIs, including syphilis and HIV. Bosky, 2007. However, teen girls may have more difficulties identifying symptoms of STIs due to these factors. Symptoms of prevalent sexually transmitted diseases such as chlamydia and gonorrhea are less frequently observed in women compared to men. Even when symptoms do manifest, they can disappear, despite the infection still being present. Women have a higher tendency than men to misinterpret the symptoms of a sexually transmitted disease as something else. For instance, normal discharge or burning and itching sensations are often mistakenly attributed to a yeast infection. In contrast, men are more likely to notice unusual symptoms like discharge. Women might not recognize the symptoms of an STD as readily as men. Genital ulcers, which can result from infections like herpes or syphilis, may form inside the vagina and may not be easily visible. Conversely, men are more likely to spot sores on their penis.
Teenage pregnancy has a variety of unique risks associated with it. Teenage mothers between the ages of 10 and 19 are more susceptible to health issues such as eclampsia, postpartum endometritis, and systemic infections compared to women between the ages of 20 and 24. Furthermore, the infants born to teenage mothers are at an increased risk of being underweight at birth, being born prematurely, and suffering from serious neonatal conditions. Additionally, 50% of teen pregnancies end with abortions, many of which are unsafe due to lack of access to proper medical care resulting from stigma or lack of medical facilities, and pose additional risks to the teen mother. World Health Organization 2022. STIs are also a large risk. Here are common STIs and their associated risks. Human papillomavirus, HPV. HPV is the most common sexually transmitted infection. There are many different types of HPV, and while some can cause genital warts, others can lead to certain types of cancers, such as cervical, anal, oropharyngeal, middle throat, and others. HPV vaccines are available to prevent the most dangerous types of HPV. Chlamydia. Chlamydia is a bacterial infection that can affect the genitals, throat, or rectum. If left untreated, it can lead to serious complications such as pelvic inflammatory disease, PID, in women, which can cause infertility. Gonorrhea. Gonorrhea is another bacterial infection that can affect the genitals, throat, or rectum. Similar to chlamydia, untreated gonorrhea can lead to PID in women, and in men, it can cause a painful condition in the tubes attached to the testicles, which can lead to infertility. And other infections such as syphilis, herpes, HIV/AIDS, trichomoniasis, and so on. Additionally, psychological effects should also be considered. Teenage girls who have engaged in sex have a rate of depression that is twice as much as usual teenage girls.
Abstinence-only education is one of the worst possible approaches to reducing the consequences of teenage sex. In short, an abstinence-only education is a state or country-mandated decree that schools within its jurisdiction only promote abstinence from sex to teenagers while avoiding comprehensive sexual education. Unlike comprehensive sexual education, which emphasizes how contraceptives can reduce the risks of STIs and pregnancy while also teaching healthy relationships, communication skills, and human development, abstinence-only education essentially just tells students to avoid having sex because it's bad. This has been statistically proven to be a terrible approach, since states with comprehensive sex ed have a rate of teen pregnancies of 5.6%, while states with abstinence-only education have a rate of teen pregnancies of 7.3%, Stanger Hall and Hall 2011. Beyond that, certain individuals attempt to have sex without a condom while also avoiding the risks of pregnancy. They do this by engaging in oral or anal sex. Admittedly, this does lower the chance of pregnancy to 0%. However, this may not prevent getting an STI. Additionally, anal sex is more likely to result in the tearing of anal lining, which actually increases the chance of getting an STI. Beyond that, it can worsen hemorrhoids or cause a rare complication such as a fistula, where a tear in the anal lining can get large enough to become a fistula. A fistula can be an emergency medical situation because it allows stool from the bowel to go to other places in the body. This infectious stool can introduce bacteria to other parts of the body, usually requiring surgery to fix. Oral sex can also lead to getting herpes. Gonorrhea and HIV is actually more commonly acquired from oral sex than vaginal sex. Another ineffective method is engaging in vaginal sex and then removing the penis from the vagina pre-ejaculation. However, studies have shown that pre-ejaculate fluid still contains sperm, which could result in pregnancy.
Addressing negative consequences of adolescent sex involves prevention of both STIs and pregnancies. Condoms are the simplest and most effective solution, providing cheap STI and pregnancy prevention. However, their usage is often limited by sociological factors, as some may value pleasure over safety. Vaccines for HPV, hepatitis A and B exist, preventing these STIs at a moderate cost, but not pregnancy. HPV vaccine in particular reduces risks of cervical and penile cancers, yet such vaccines require nationwide programs and political support for maximal effectiveness, facing social stigma and economic implications. Contraceptive methods like IUDs and birth control pills primarily prevent pregnancy. IUDs, hormonal or copper-based, work by making the uterus less receptive for egg implantation, though they necessitate surgery and parental consent. Birth control pills, though effective when taken consistently, are typically prescription-based and come with various side effects from nausea to changes in menstrual cycles. Emergency contraceptives like morning-after pills can prevent pregnancy post-unprotected sex. However, they vary in availability and effectiveness, with levonorgestrel-based pills available over the counter but having lower effectiveness, while ulipristal acetate pills are more effective but often require a prescription. Fertility Awareness Method, FAM, is a non-medical intervention that's highly effective when followed correctly. It involves tracking menstrual cycles to identify safe days for intercourse. Its practicality is limited as adolescent sex is often unplanned. K. 2021. Overall, condoms stand as the most accessible and reliable contraception and STI prevention method, despite occasional non-compliance. Comprehensive sex education, societal and cultural norms, and economic factors contribute to lower teen pregnancy rates, as evidenced in countries like Japan, which has a 0.4% teen birth rate, World Bank 2020. While creating advanced societies discouraging irresponsible behavior can be a viable solution, it demands substantial changes in policies, industry, and education, making it practically challenging. Office of Communications, 2017.
The New York City Condom Availability Program, CAP, initiated in 1981, aimed to curtail HIV, AIDS, and unintended pregnancies by freely distributing condoms at public places, including high schools, since 2005. Despite controversy over potentially encouraging sexual activity among teens, research shows the program increased condom use without affecting sexual activity rates. Considered the world's largest municipal condom distribution effort, the program has led to reduced STIs and unintended pregnancies, NYC Health 2014. Another study underscores teachers' pivotal role in introducing comprehensive sex education in Cameroon to achieve Millennium Development Goals. Despite resistance due to cultural beliefs, the study emphasizes the need for teachers to change their conceptual understanding and adopt socio-constructivist didactic strategies. It highlights the challenge of balancing social pressures and fostering appropriate citizenship concerning sex education. The study recommends future strategies should consider the interplay of knowledge, values, and social practices, arguing that a sole focus on cognitive development hasn't significantly reduced HIV/AIDS/STI incidence. Fumain et al. 2013.
In conclusion, teenage sex has massive consequences on individuals and society at large. It can cause severe consequences, such as pregnancy or infection. However, it can be prevented through the careful use of contraceptives, which can be distributed for free. Society at large has to further change and advance economically, while also informing teenagers with comprehensive sex education in order to reduce teen pregnancy and STIs.